If you have knee pain, continuing certain exercises may actually make it worse. Many people believe all exercise is good for knee pain, but that's not always true. Doctors and physical therapists often see older adults doing movements that put extra stress on painful joints, leading to more pain, stiffness, and difficulty with daily activities. The problem is that pain doesn't always appear immediately. You may feel fine during exercise, only to notice soreness later that day or the next morning. If you experience knee pain while walking, climbing stairs, or standing up from a chair, you're not alone. Many adults over 60 find that knee discomfort slowly affects their confidence and independence. One common myth is that the knee itself is always the problem. In reality, weak hip muscles, poor movement patterns, joint stiffness, and limited mobility can all increase pressure on the knees. Think of the knee as part of a chain. When muscles above or below it aren't working properly, the knee often takes on extra stress. Many seniors also develop a fear of movement. For example, a 72-year-old woman named Carol gradually stopped walking with friends because she worried about pain and falling. Over time, her confidence decreased, and she became less active. Health experts often see the same cycle. Pain leads to less movement. Less movement causes weaker muscles. Weaker muscles increase stress on the joints. Then the pain gets worse. That's why it's important to identify exercises that may be aggravating your knees. Surprisingly, the problem isn't always a difficult exercise. Sometimes it's a common movement that seems harmless, but places unnecessary pressure on the joint. The goal isn't to stop exercising. The goal is to avoid movements that work against your mobility, independence, and comfort. Another important factor is inflammation. When a knee is already irritated, certain exercises can make symptoms worse. What works for one person may not work for another. Physical therapists frequently note that success comes from choosing the right exercises and avoiding the wrong ones. In the next section, we'll look at some of the most common exercise mistakes that can quietly worsen knee pain and make everyday activities more difficult. Now that we've discussed why knee pain can become a frustrating cycle, let's look at what often happens next. Many people think they should push through pain during exercise, but this can sometimes make knee problems worse. Doctors often see people whose knee pain increased because they kept doing painful movements. As a result, walking became harder, stairs felt more difficult, and daily activities became challenging. One reason is that knee pain develops gradually. Repeated stress can irritate the joint, especially when surrounding muscles are weak. That's why many seniors say, "It wasn't this bad before. I used to walk farther." The changes happen slowly and are easy to miss. Another concern is how knee pain affects daily life. You may avoid walks, stay home more often, or become less active. Over time, this can reduce strength, balance, and confidence. For example, Robert, age 69, started avoiding stairs because of knee pain. Later, he noticed weaker legs, poorer balance, and more difficulty standing from a chair. Health experts often see this pattern. Less movement leads to weaker muscles. Weaker muscles provide less support to the knees. This makes everyday activities harder. There's also another hidden issue. Some exercises place extra pressure on already irritated knees. If the joint is inflamed or worn down, certain movements may increase discomfort instead of helping. This doesn't mean exercise is bad. It means choosing the right exercise is important. In the next section, we'll reveal the 5 exercises that may be making knee pain worse for some people. Remember, if an exercise causes sharp pain, swelling, or discomfort that lasts for hours afterward, your body may be telling you something important. The right movement can improve mobility and confidence. The wrong movement can make knee pain worse. And the 5th exercise may surprise you because many people use it specifically to strengthen their knees. Let's look at the 5 exercises that may be making your knee pain worse. Remember, these exercises are not necessarily harmful for everyone. However, if you already have knee pain, arthritis, stiffness, swelling, or discomfort during daily activities, they may be contributing to the problem. Exercise number 1. Deep squats. Many people with knee pain notice discomfort when standing up from a chair, climbing stairs, or bending down to pick something up. The emotional impact can be frustrating. You may start avoiding activities you once enjoyed because you're worried about triggering pain. The hidden cause is that deep squats can place significant pressure on the knee joint, especially when the knees bend far beyond 90 degrees. If the joint is already irritated, this extra pressure may increase inflammation and discomfort. Over time, continuing painful deep squats may lead to more soreness and less confidence in movement. Instead, consider partial squats or sit-to-stand exercises from a sturdy chair. These movements help strengthen the legs while reducing stress on sensitive knee structures. The benefit is improved leg strength that supports walking, standing, and maintaining independence without placing excessive strain on the joint. Exercise number 2. Running on hard surfaces. Many seniors notice knee pain becomes worse after long walks or activity on concrete sidewalks. The emotional impact is often disappointment. You want to stay active, but exercise seems to leave your knees aching. The hidden cause is repetitive impact. Every step creates force that travels through the knees. When performed on hard surfaces, that force may become harder for sensitive joints to tolerate. If ignored, ongoing irritation may contribute to increased soreness and reduced activity levels. A better solution may be lower impact options such as walking on softer surfaces, swimming or cycling. These activities keep you moving while reducing stress on the knees. The benefit is maintaining cardiovascular health and mobility without unnecessary joint irritation. Exercise number 3. Jumping exercises. Some people experience sharp knee discomfort during movements that involve hopping, jumping, or sudden landings. The emotional impact can be fear. You may begin worrying that your knees are becoming less reliable. The hidden cause is the high force created when landing. Sensitive joints may struggle to absorb these impacts efficiently. Over time, repeated stress may aggravate existing knee problems and increase discomfort. Instead, focus on controlled strength and balance exercises that build stability without impact. Examples include supported heel raises, gentle step-ups, and chair-assisted balance work. The benefit is improved stability and confidence during everyday activities while reducing unnecessary strain. Exercise number 4. Deep lunges. Many adults notice knee pain when stepping forward into a deep lunge position. This can make everyday movements feel more difficult and may reduce confidence in your mobility. The hidden cause is that deep lunges can place large forces through the front knee, especially when performed with poor form or limited hip mobility. If irritation continues, discomfort may increase during walking, stair climbing, and standing activities. A safer alternative may be shallow lunges, supported split stance exercises, or physical therapist-approved strengthening movements. These options help build strength while keeping joint stress more manageable. The benefit is stronger legs that better support daily movement and independence. Exercise number 5. Leg extension machines. This is the exercise that surprises many people. You often see it recommended for strengthening the front of the thighs. However, many physical therapists are cautious when knee pain is already present. The symptom is pain around or behind the kneecap, during or after exercise. The emotional impact is confusion. You're trying to strengthen your knees, yet the exercise seems to increase discomfort. The hidden cause is that leg extension machines can create significant force across the knee joint, particularly near the kneecap, depending on the amount of resistance used. For some individuals, especially those with arthritis or kneecap-related pain, this may increase irritation. If the discomfort continues, daily activities may become more challenging. A better option may be functional strengthening exercises such as sit-to-stands, gentle step-ups, or other movements recommended by a healthcare professional. These exercises train the muscles in ways that often relate more closely to everyday life. The benefit is improved strength for walking, climbing stairs, and maintaining independence. Now, here's the important takeaway. The goal isn't to stop moving. The goal is to stop doing movements that repeatedly aggravate your knees. Many people experience meaningful improvements when they replace painful exercises with joint-friendly alternatives. But there's one more important discovery that can make an even bigger difference, and we'll discuss that next. Before we finish, remember one important thing. Avoiding harmful exercises is only part of the solution. Your knees also need strong muscles, good balance, flexibility, and regular movement. Many people improve when they focus on gentle exercises, hip strength, and low-impact activities. For example, Margaret, age 74, stopped doing painful exercises and started walking regularly, improving balance and mobility. After a few months, she felt more stable, walked more comfortably, and regained confidence. The goal isn't always to remove every ache. It's about improving movement, confidence, and quality of life. Doctors often recommend staying active but choosing exercises that help rather than hurt. If an exercise causes ongoing pain or swelling, talk to a healthcare professional. Also, consistency matters more than intensity. Simple habits like walking, chair exercises, balance practice, and light strengthening can make a big difference over time. Remember, pain can lead to less movement, weakness, and more joint stress. But better movement can build strength, support the joints, and help you stay active. If you found this helpful, please like, subscribe, and share. Most importantly, knee pain doesn't always mean giving up the activities you enjoy. By choosing better movements and staying consistent, you can support your mobility and independence for years to come.